My name is Dr. Amy Clements-Cortes. I'm here today giving you a short introduction to one of the topics that is part of the tutorial called the role of music therapy in relationship completion at end of life. After hearing about this model of music therapy, I hope you will take the full tutorial to become acquainted with the important work of relationship completion in working with patients in palliative and hospice care. So today I want to talk to you about the Dileo and Dneaster model of music therapy in palliative care. So Dileo and Dneaster have delineated 3 levels of practice. They are the supportive, communicative expressive, and the transformative levels. Since I would say the early 1980s and maybe even into the late 70s, music therapy started to become more written about in palliative care. And so there are a number of goals that have been discussed in the research area in a lot of descriptive articles as well as research studies. And so here, I want to give you just a kind of a snapshot of some of the goals that can be accomplished within this Dileo and Dneaster model at the different levels of practice. So beginning at the first level of practice is the supportive goals. So here, the idea is to support the symptoms that are common to people that are experiencing end-of-life care. So to help palliate those symptoms. So for example, we know that music therapy is effective with symptom management. For example, some of the things like reducing agitation, assisting with breathing, and enhancing that overall sense of relaxation. And on the slides, you will see just a few articles that are quoted to kind of give support to some of those goal areas. At the next level of practice is the communicative expressive level. Here, the title is very self-explanatory. The overall idea is to help the client express emotions and find that avenue for communicating those sentiments and expressions that could be challenging at end of life. So here, definitely one of the goals is to express feelings. It is to also help maintain identity, enhance self-esteem, right, by becoming connected to the person that they once were and helping them feel that they are still connected at this stage of life. It's also important to acknowledge some difficult feelings, to acknowledge fear, to acknowledge sadness, and to also acknowledge denial when appropriate. At the third level of practice is the transformative goals. So here, the patient has to have the necessary energy and desire to complete this type of work at end of life. But there are a number of goals that can be accomplished here. So things like assisting with life review. And life review is so important. And musical life review can really be so beneficial for clients because it offers that extra connection to the emotions and also is just very good way at getting in touch with things that are difficult to talk about. Facilitating reminiscence, right? And that can also be very important at end of life. Looking back and assessing goals and accomplishments, as well as looking at regrets. Here, this is where relationship completion fits in. So completing relationships with oneself, with other persons, with the transpersonal or spiritual entities. And so that's what the bulk of this tutorial will focus on. Also things like exploring afterworld beliefs or where a person may go in their next place of being, experiencing forgiveness, offering forgiveness to others, as well as experiencing peace in working towards what can be considered a good death. So that's just been a little snapshot about the Dileo and Dneaster model, one of the things that you will hear about in the tutorial on relationship completion at the end of life. So thank you, and don't forget to check out the full tutorial, which is online at musictherapyonline.org.